From Texas is recognized for 5 minutes in support of his amendment.
Thank you, Mr. Chairman. I'm offering this amendment in the nature of the substitute for the Chandra Asenga Human Cell and Tissue Product Safety Act, sponsored by Representatives Molinar and Dingell. I want to be clear, I support the underlying bill, and this AINS would keep that bill intact and add an additional legislation as well, which I'm going to talk about now. The underlying bill, as my colleague just explained, is for Chandra, who tragically passed away from tuberculosis last year, becoming sick after a contaminated bone graft during surgery, something that no patient should ever have to go through. These cell and tissue products can save lives, but we have to ensure that the standards are clear, that providers and patients are educated on the risks and the benefits. And this bill does a couple of key things. Educates patients, providers, and industry. It also ensures that the FDA has the most up-to-date guidance so that industry can properly screen for pathogens like tuberculosis. Second, the bill includes important bipartisan policies that I worked on with Representative Barragan, which I really appreciate her bipartisan support on this. These are policies that are going to encourage innovation in regenerative medicine. So you might ask, what is that? What is regenerative medicine? Regenerative medicine is when we use the human body to heal disease. And in some cases, we're quite literally using a patient's own body, their own cells, to cure disease. It's one of the great medical miracles of our time, but to succeed, we've got to make sure that the regulatory environment encourages innovation, because these are complex therapies and there's a lot of emerging science. So what this bill does, it encourages more FDA communication with innovators. And this bill also moves us closer to a new pathway so that we are not applying a one-size-fits-all regulation to some of the most life-changing, life-saving cell therapies. This is something I plan to continue to work on with the FDA, because the wrong regulation can quite literally mean the difference between innovation that saves lives and patients that are left out in the cold with no options. This amendment will advance safety and innovation, and I ask everyone to vote in support of it. Thank you, and I yield back.